preventing surgical site infection in the operating room is the primary goal of the surgical team, and all activities performed by the team support this goal, some of which are the standard precautions appropriately done before each operation, such as medical hand washing and surgical hand scrubbing, followed by donning a sterile gown and close gloving. Medical hand washing and surgical hand scrubbing are done for the following purposes:
to reduce the number of microorganisms on the hands, to reduce the risk of transmission of microorganisms to clients, to reduce the risk of cross-contamination among clients, to reduce the risk of transmission of infectious organisms to oneself, and to remove resident and transient microorganisms.
We are about to assemble all equipment such as
Nail cleaner, sterile brush, antimicrobial surgical hand scrub, warm running water from faucet, sanitized towel.
proper assembling of equipment facilitates continuous and smooth flowing procedure.
Nails should be kept short. Short natural nails are less likely to harbor microorganisms, scratch a client, or puncture gloves. Remove all jewelry. Removal facilitates proper cleaning of the hands and arms. Check the hands for breaks in the skin, such as hangnails or cuts. Put on protective attire such as scrub suit, cap, and mask prior to beginning scrub. Protective wear prevents exposure to blood and body fluid splashes during the procedure. It also prevents bacteria, saliva, mucus, and fallout such as facial hair from contaminating the sterile field. Mask prevents escape into air of microorganisms that can contaminate hands. Pull arm sleeves up to shoulder level. Surgical hand scrub also involves the arms. Arm sleeves should be pulled up so that the sleeves won't get wet. Remove all types of hand, wrist, or arm jewelry. Microorganisms can lodge in the settings of jewelry and under rings. Removal facilitates proper cleaning of the hands and arms. Turn on the water and adjust the flow so that the water is warm. Wet hands thoroughly by holding them under running water, letting it run from the fingertips to the elbows. Apply 2 to 4 ml of liquid soap to the hands. Wash hands using friction on all surfaces. Continue this motion for at least 15 seconds. Palm to palm. Right palm over left dorsum. And left palm over right dorsum. Friction and rubbing mechanically loosen and removes dirt and transient bacteria. Palm to palm, fingers interlaced. Interlacing the fingers and thumbs cleans the interdigital spaces and ensures that all surfaces are cleaned. Backs of fingered to opposing palm with fingers interlocked. Rotational rubbing of right thumb clasped in left palm. And rotational rubbing of left thumb clasped in right palm. Rotational or circular action helps remove microorganisms mechanically. rotational rubbing backwards and forwards with clasped fingers of right hand in left palm, and rotational rubbing backwards and forwards with clasped fingers of left hand in right palm. The nails and fingertips are commonly missed during hand hygiene. If hands are not visibly soiled, wash to 1 inch above the wrist. Rinse hands tolerably by letting the water run from fingertips to elbows until the cleaning agent or liquid soap is removed. Rinsing the hands this way makes the water run from the area that has fewest microorganisms to an area with a relatively greater number of pathogens. Obtain nail cleaner with hands. Clean beneath and around each fingernail with a nail file or orange stick under running water. Microbes also lodge under the nails. Using a nail file allows proper removal of dirt and organic material that harbor large numbers of microorganisms. Drop nail cleaner in sink when complete. Place all fingers of one hand together and brush across nail tips for 30 strokes. Mentally divide each finger and thumb into 4 planes and scrub each plane separately for 5 strokes, for a total of 20 strokes for each finger. Scrub the palm of each hand for 20 strokes using a circular motion. Scrub the back of each hand for 20 strokes using a circular motion. Using the same brush, scrub the other hand using the same technique. Friction loosens resident bacteria that adhere to skin surfaces. Surgical hand scrub ensures coverage of all surfaces. Scrubbing is performed from cleanest area to the marginal area. Mentally divide one arm from wrist down to 2 inches from the elbow into 2 or 3 sections. Further divide each section of one arm into 4 planes. Beginning with the section nearest your hands, scrub each plane with 5 strokes using a circular motion. Friction loosens resident bacteria that adhere to skin surfaces. Surgical hand scrub ensures coverage of all surfaces. Scrubbing is performed from cleanest area, or the hands, to the marginal area, or the upper arms. Using the same brush, scrub the other arm using the same technique. After which, discard or drop the brush in the sink. Flex your arms and rinse from the fingertips to the elbow in a single smooth motion, allowing water to drip from elbows. Hands should remain the cleanest part of the upper extremities. Rinsing the hands this way and keeping the hand higher than the elbows makes the water run from the area that has fewest microorganisms to an area with a relatively greater number of pathogens. Do not move arm back and forth under the water. Avoid splashing water or lather onto the surface of the scrub suit or gown. Water splashed from the contaminated sink will contaminate clothing. Always keep hand higher than the elbows to prevent water from running back from a non-scrubbed area to a scrubbed area. The water should flow from the least contaminated to the most contaminated area. Release water control and allow the water to drip from elbows for a few seconds before moving away from the scrubbing area. Walk backward into the operating room while keeping your hands elevated at waist level, with the elbows flexed in front of you but away from your body. Walk to the table containing an unwrapped sterile towel while keeping a slight distance from it. Pick up the sterile towel by its folded edge without dripping water into the sterile field. Use one end of the towel to dry one hand completely using a rotating motion and moving from fingers to elbow. Use the other end of the towel to dry the other hand and forearm in the same manner. Drop the towel into the designated receptacle.
However, skin cannot be sterilized. That is why donning a sterile gown and close gloving are necessarily performed by all members of the surgical team.
In order for them to handle or touch sterile objects freely without inducing contamination and to prevent transmission of potentially infective organisms from their hands to the client.
Before doing the procedure, we should prepare and assemble equipment such as a clean, flat, and dry surface, a sterile pack containing the sterile gown, sterile gloves of appropriate size,
Surgical scrub uniform, cap, and mask.
Proper assembling of equipment facilitates a continuous and smooth flowing procedure.
Don surgical attire. Donning surgical attire prevents contamination of sterile field. Perform hand hygiene or hand antisepsis procedures to remove transient and resident bacteria from fingers, hands, and forearms. Ensure the sterility of the packages of gloves and gowns. All sterile items must be checked for sterility prior to use. Always examine sterile packages for expiry date, intactness, and tear. Unwrap the sterile gown pack. Remove the outer wrap from the sterile gloves and leave the gloves in their inner sterile wrap on the sterile field. Perform scrubbing of hands and arms. Identify the inner surface of the gown and pick up the gown beneath the neckband. Avoid touching the sterile field or the outer surface of the gown. Move away from the table, holding the gown away from body at arm's length. Allow the gown to unfold from the top down. Do not let the gown touch the floor and avoid dangling the gown against unsterile surfaces. Hold the gown just below the neckband near the shoulder. Slide both hands and work the arms partway into the sleeves until the fingers are at the end of the cuffs but not through the cuffs. Have a co-worker grasp the neckties without touching the outside of the gown and pull the gown upward to cover the neckline of your uniform in front and back. The person tying the gown should take care to touch only the ties and not the front or sides of the gown. With hands covered by the sterile gown cuffs, open the inner sterile glove package. Hands remain clean. Sterile gown cuff will touch sterile glove surface. With the dominant hand, pick up the opposite glove with the thumb and index fingers, handling it through the sleeve. Lay the glove on the opposite gown cuff, thumb side down, with the glove opening pointed toward the fingers. Use the non-dominant hand to grasp the cuff of the glove through the gown cuff and firmly anchor it. With the dominant hand working through its sleeves, grasp the upper side of the glove's cuff and stretch it over the cuff of the gown. Place the fingers of the gloved hand, which is the non-dominant, under the cuff of the remaining glove. Cuff protects gloved fingers. Sterile touching sterile prevents glove contamination. Place the glove over the cuff of the second sleeve. Extend the fingers into the glove as you pull the glove up over the cuff. This is to ensure smooth fit over fingers. Pull the sleeve up to draw the cuff over the wrist as you extend or push your fingers into the glove's fingers. Adjust gloves for fit and comfort while maintaining sterility. This is to ensure full dexterity while using gloved hand. When worn, sterile gowns should be considered sterile in front from the waist to the shoulder. The sleeves should be considered sterile from 2 inches above the elbow to the cuff, since the arms of a scrubbed person must move across a sterile field.